am actually delighted to be able to speak with you twice during this fabulous, fabulous conference. And for this first talk, I'm going to speak to you actually not as a techno-evangelist, but as a fanboy. And as a fanboy specifically of a terrific story that's in the process of unfolding in the great American city of Cincinnati, Ohio. Many of you are undoubtedly familiar with the extensive body of research that's been done that has demonstrated large variation in cost of care, quality of care, and health outcomes across the country. It turns out that health care is significantly better and simultaneously costs a lot less in some places than others. But here's what will be really interesting. What if a community decided, you know what, where I currently stand isn't good with me. I don't accept my place in the healthcare universe. I want to change. I want to actually go from average to good or good to great. What if that happened? And what I want to do is tell you a story today about an American city that has summoned the nerve to try. It's still in its early stages. It's very, very early. And so consider this an early check-in, but it's definitely a story that you want to check out and follow in the years to come. Cincinnati is a city on the banks of the Ohio River, about 2 million people. In the early 19th century, it was one of the first boom towns in the heartland to rival East Coast cities in prosperity and size. It's today home to 9 Fortune 500 companies like Procter & Gamble, the Kroger Company, GE Aviation, and more. And it takes great pride in its heritage, in its strong work ethic, and in the sense of shared destiny, and a shared sense of commitment to all of its residents. It's also a very competitive healthcare market with many successful healthcare institutions. Doctors and hospitals compete ferociously for market share. But on top of that, they've also begun to join forces as well with employers, insurers, government community leaders, and citizens to try to make health and healthcare a competitive advantage for the entire city of Cincinnati and ensure its economic viability and strength for decades and decades to come. So here's what they did. A few years ago, a group of stakeholders, representing actually all those different constituencies I just talked about, started to actually get together regularly and talk. They tried to grab all the data they could to try to understand health status in their community and the performance of the care delivery system. They came together under the auspices of a nonprofit they formed called the Health Collaborative that was a neutral meeting place, if you will, where anyone who was really passionate about improving the health and economic viability of Cincinnati could get together, hang out, brainstorm, and try to solve problems. Now, I don't want to give you the impression that it was all rainbows and unicorns in Cincinnati at the time. There were actually a lot of tensions between physicians and employers, or between insurers and physicians, between hospitals and hospitals on a variety of issues. Hospitals were merging, they were splitting, they were competing for docs. But actually, amid all of that, folks said, look, we have to find some things we can agree on and work on together. So they started small. They started with flu shot coverage and began to collaborate to actually increase flu shot coverage, experience success, began to build a little trust, and start to see the value of collaborating in key arenas. And over time, the group started to pick up steam. They started to grab more and more data and really take a hard look at it, a really hard, objective, truthful look at it, and say, like, where do we stand compared to other parts of the country? And what they found was that they were resoundingly average. On most measures of health status, average or maybe a bit below average. On quality of care, very, very average. On per capita cost of care, risk adjusted, average, maybe a little higher than average. And there are actually some places that might say, you know what, that's cool, I don't suck, and that is really good. But that's not how Cincinnati rolls. Cincinnati said, you know what, we don't want to be average, we want to be awesome. So how do we become awesome? And a consensus started to emerge slowly but surely, and they put together a plan of attack. And here's a quick sketch of that plan. So first of all, they, with a group led by leading primary care docs, put together a set of common performance metrics for the healthcare system, metrics on which every care provider would be measured, and an ongoing system of measurement to produce reports on those metrics, which everyone could actually see. Critically, critically important. And they began to set goals that they wanted to hit and measure progress toward the goals. Vitally, vitally important. Secondly, they began to realign how healthcare is paid for in Cincinnati. The employers and the health insurers began to collaborate on saying, look, we got to move from a fee-for-service, pay-for-volume system to one that pays for value, pays for keeping people healthy. And again, they didn't boil the ocean. They started small. They recruited a group of initial docs and offered those docs extra payment incentives, electronic health records, and basically other resources to help them coordinate care more proactively for patients, leverage data to actually maximize the proactive engagement of patients, and doing the stitches in time that would save the hospitalization, the complication ER visit, and again, provide better health outcomes, higher quality care at lower cost. to help actually facilitate this care delivery innovation that was oriented toward health maximization. They accelerated the deployment of electronic health records and meaningful exchange of information between providers, leveraging HealthBridge, one of the best and most well-established health information exchange networks in the country. And because a lot of the clinicians involved hadn't necessarily been well-versed to date in modern performance improvement techniques that actually hadn't been part of the curriculum in med school, they sponsored a whole bunch of free classes or low-cost sessions where clinicians could learn about modern performance improvement techniques and actually apply those to their clinical processes and practices. And finally, they critically emphasized the need to put the consumer at the center of this entire enterprise, because it's all about the consumer, all about the patient ultimately. And so, for example, among other things, they put the power of information at the fingertips of consumers, publishing a website that had, by physician, performance metrics that were actually translated with the help of P&G into a form that consumers could understand, so they really could make the best decisions for them and their family about where to get care. So in terms of talking results, it's still incredibly early, but there are some promising early signs. So for example, there's a cohort of physicians across Cincinnati who have actually adopted this medical home type model where they get added payment incentives using electronic health records and actually invest and are able to invest in more proactive care coordination. And over the course of 2010 to 2011, this cohort actually improved the population of patients who were receiving essentially perfect diabetes care by 10% compared to the control group's improvement about 1%. Cincinnati Children's Hospital, another data point, which has been a longtime leader in asthma care, led an effort to apply leading-edge asthma care model to a population of about 1,400 high-risk pediatric asthma patients, including many who were Medicaid beneficiaries. And in 1 year, this effort actually increased the rate of kids who had asthma well under control of the population from about 28.6% to 75.6%. Which was phenomenal. And then over the course of 2007, 2009, one final data point is that ER visits across Cincinnati were actually rising at a steady clip about 7% a year. And then in 2010, there was a significant drop in ER visits, and the delta between expected and observed amounted to essentially a savings of $200 million for the community, which is quite remarkable. And there are a multitude of forces that are helping and joining in and joining the fun. So the Robert Wood Johnson Foundation, P&G, GE have loaned experts everything from quality measurement to how to build a great consumer website that actually relays information in a sensible and actionable way. The U.S. Department of Health and Human Services actually designated Cincinnati as a beacon community for the use of health IT, providing funding to help accelerate the use of health IT to improve health. The Center for Innovation at Medicare has designated Cincinnati as one of the markets that will participate in its comprehensive primary care initiative, a multi-payer initiative where Medicare will join other insurers in providing payment bonuses and resources to primary care docs to power better care coordination on behalf of patients. And it's very, very encouraging. It's an early in development story, but very, very encouraging. And it's not a story about silver bullets or magic tricks, right? I mean, healthcare is complicated. There aren't single silver bullets you can fire that will magically, radically improve quality, affordability, and health. But what is clear to me is that the people best positioned to drive systematic, sustained improvement in American health and healthcare are the men and women on the ground in our communities across the country. People who are willing to roll up their sleeves, put aside their differences, and get to work. I can't wait to see this narrative continue to unfold in Cincinnati and communities across the country. It's an amazing, amazing thing that we're beginning to see. I hope you'll join me in cheering them on. God bless you, Cincinnati, and may the force be with you. Thank you so much.